you just can't give up on your health, right? That's just not something you should do, right? I know it's really hard to stay hopeful. Keep trying new things. And if you tried something and it didn't work, don't take it as a loss. Don't take it as a waste of time because you need to be trying different things. And that means that you're likely going to have a lot of things that fail until you find the thing that succeeds.
All right, welcome back to the Spero Means Hope podcast, where we take storytelling to a whole new level by sharing amazing patient stories, review experts in the community, and share resources for clinicians and students. So today we have with us Jimmy. How are you doing, Jimmy?
I'm doing well. Happy Friday.
Happy Friday! And Jimmy is a therapist who we're very excited to connect with today. Jimmy, can you start by telling us a little bit about yourself? So where are you from? What do you do for a living, of course, and then what do you do for fun?
So, where I'm from, that believe it or not, that's actually a loaded question because I was born American, but I actually grew up abroad as an expat. So I lived in Beijing for 15 years before I finally came back to the United States when I was 18. So I don't really know where I'm from. I'm from all over the place. I've moved a lot. And then in terms of my career, right now I currently have a mobile practice here in San Diego. And my practice is focused on treating vestibular as well as headache disorders. And my journey into this specific field or niche is largely driven by my own lived experience as someone with chronic pain and chronic migraine.
Oh. Can you share a little bit more about that experience?
Yeah, so it started pretty much right after PT school. So I graduated from PT school, and then I started developing, really severe back pain. Some of it was probably related to some of the sports I was doing at the time, but I started having pretty bad disabling back pain. And then eventually I started having left foot pain as well. And just kind of this widespread pain was starting to develop in my body. And I was starting to feel just very fatigued and kind of brain fog. And then, fast forward 2 years, I got a diagnosis at the time. And I would say it's a misdiagnosis. I was diagnosed with some kind of spondyloarthropathy. And then, I thought my problems are solved. And then that ended up not being the issue. And then the interesting thing is I'd been spent 2 years trying to find an answer. I finally supposedly had an answer. And then a few days later, I woke up. I actually woke up ataxic. So I woke up to go to the bathroom, and then I was unable to walk in a straight line. I would scissor every 3 to 4 steps. And then I developed a headache with that. Migraine headache. And so then I became a chronic headache patient. So I had headaches. So, I've had, I would say more or less 24/7 hour headache for probably about, I want to say 6 years, 7 years. So it's like, I think 8 years of back pain, foot pain, headache pain, arm pain. And then migraine comes with a whole host of other things like autonomic dysfunctions. So started experiencing like a lot of dry mouth, and it even like led to some dysphonia. So it's been a long road. I had to stop working for a few years. And now, after a lot of work, a lot of patience, I think I'm in a lot better place now. And so that's kind of where I'm at. And I think it's really what drives me in regards to my practice.
Wow. Were you able to eventually receive an accurate diagnosis that explained like the ataxia?
Yeah, so the ataxia is basically an atypical migraine presentation. So my migraines are very different. Well, I should say migraines because migraine is a neurological disorder. My specific migraine presentation is that I present with, I have a lot of facial pain. When I have a severe attack, yeah, I experience this episodic ataxia. I haven't had one, luckily, in over a year. But migraine comes with so much else. It comes with the autonomic dysfunction. So like the sinus congestion. It also I get ptosis in the right eye sometimes as well. And I think it just speaks to just how varied this world of headache is. And there's just a lack of awareness around it. Just for any of you listeners, there's a document out there called the International Classification of Headache Disorders. And if you look on it, there's actually over 300 headache disorders that exist.
Wow.
And when it comes to migraine, migraine is actually the second leading cause of disability in the world. First leading cause of disability in women under 50. Yet
Wow.
it's not really talked about, even among PTs, right? I think PTs, we have a lot to offer, but the guidelines we currently have are not by any means perfect. I don't think we have a CPG for migraine management. There isn't much literature out there, and there isn't enough research, I think, because I think we could make a really big impact if we just directed more of our resources towards it.
Oh, thanks for I'm learning so much because I definitely did not know there were that many different types of headaches, and so thanks for sharing that information. I'm glad to know you're in a much better place now. What would
Yeah.
you say are some of the resources that have helped you the most? And also, as a PT that treats headaches, where do you look for resources since, as you're saying, it's we don't know enough about migraines and headaches?
Yeah, that's an excellent question. So, there is no cure for migraine. I make that very clear with all of my patients, right? But migraine, what it does lead to certain dysfunctions in the neck, in the head, shoulders up, really. It can lead to dysfunctions all over the body. But generally speaking, it's like the shoulders and up. And so we'll start seeing things like muscle tightness, you know, maybe impacted even cervical proprioception, right? These are things that I think a lot of orthopedic PTs actually have um, a lot of experience in, and they could actually do a lot with these migraine patients. But going beyond that, we know migraine also presents with um, there are also variations. So like vestibular migraine. Now with vestibular migraine, that's when you want to start thinking about vestibular therapy. But the mistake that some people make with vestibular migraine is they only try to address the vestibular side of things without
Hmm.
trying to address everything else, like the neck, as well as, lifestyle factors, sleep. This is all really important, and it's going to be very different for every patient. And then for me, interestingly enough, biggest issue was actually convergence insufficiency. I was having a lot of trouble reading. I was having a lot of trouble with screens, anything where I had to focus. Excuse me. And so, yeah, so I went through 12 weeks of vision therapy. Vision therapy is a separate discipline. There's a fair amount of overlap between because PTs can treat convergence insufficiencies, but we are nowhere near as adept at as vision therapists are. So there's a lot to learn from them as well. So generally speaking, when I think about a migraine patient, I borrow a lot from the concussion world, right?
Hmm.
Because we have some of our best research around headaches and our best guidelines around headaches is specifically concussion. And there's actually a lot of overlap because the systems that are impacted by migraine, you also see them impacted by concussion, right? There's even concussions that lead to migraine. So generally speaking, I'm always thinking very much about the neck. And then I'm thinking about the other sensory systems of the head. So the vestibular system, the visual system, cervical proprioception. Is there a mismatch anywhere along these systems? And then if you can really hone that down and you can make it very clear, like, oh, this is where the problem is, this is where the biggest deficit is, then you can make a very big impact on your patient's migraines.
Oh. Oh, I love that. Would you say that your experience, like being on the patient side and dealing with migraine yourself, has a big influence on your practice as a therapist?
Yes, it definitely does. I think on one end, it's very personal, right? It makes a lot of sense. And then I think also, this is something I like to talk about with people too, is the logistical side of things. I was always more interested in neurology as a PT. I was always more interested. And so starting my career, I worked in acute rehab and, I enjoyed working with things like, stroke patients, spinal cord injury. PTs know these are very physically taxing populations to work with. So I finally reached a point a few years ago where I just admitted to myself that this is not something that was compatible with my body the way it
Mm.
was. And I was like, well, I know I didn't want to go into ortho. So, so the next logical step was going into vestibular, right? And so
Mm.
um, generally they're all ambulatory, and so and I'm really grateful that it happened actually because I think vestibular is a very fun world to be in. It's just so many very like funky presentations that come up. And then naturally, vestibular actually lends itself pretty well into treating headaches as well. And so I also borrow a lot from the evidence around vestibular disorders, and I try to apply that to also to migraine. But as far as things go, we do not have a clinical practice guideline for migraine. So, and a migraine, it can have presentations that are similar to concussion, similar to neck pain, similar to vestibular disorders. And so it's a mixed bag, but you can really borrow from the different CPGs that we currently have and then kind of blend them together to get the ideal treatment, personalized treatment plan for your patient.
Nice. I love how you're drawing these links, like using principle of concussion management and vestibular management. I hope this eventually leads to CPG for headache management. I mean, as complex and varied as
Yeah.
it is, I hope to see that work come out in the future.
Yeah. Yeah. Me
Yeah.
too.
Yeah.
Yeah.
Yeah. If you look at your journey navigating that your chronic illness from maybe first like early days in diagnosis to how you are now, can you think of maybe like a milestone that you've accomplished, something that initially when you were in the thick of it, you thought like, I don't know if I'll ever be able to do this again, something that
hmm
you're just very proud of?
Uh, I'm just glad to be working. Um,
Yeah.
you know, it was hard. I wasn't working. I think I think at my age, not working definitely had a big impact on my self-esteem, right? Um, and that's not to say that, everyone should work, right? Some people have very disabling conditions and it's just probably better not to work. And there shouldn't be any shame in that at all, right? But for me, I'm very glad that I'm fortunate enough that I was able to get to a point where I felt like, okay, I can work. Like I can go back to work. I have to make certain adjustments or I can't be seeing the total assist, max assist patients anymore. But if I structure things around that, I can work. And to the point that now I have my own practice, right? I have my own
Yeah.
mobile practice. So I think I do take a lot of pride in that. I do take pride in my work. I was surprised at how much I enjoyed the vestibular world after I started treating these populations. You know, um, I had a vestibular patient, he had 4 years of chronic dizziness and no one really ever did anything for him. And then I worked with him for about 6 weeks and, now he's virtually asymptomatic.
Wow.
And he's, doing rides at Disneyland with his kids, no roller
Hmm.
coasters. But so that was incredibly rewarding. And, I think it also just showed me like, oh, wow, like this field is like really well researched and like it really works and we can make a really big difference. Um, so, things, uh, oddly enough, things went in a good direction. I wouldn't say they worked out, but things went in a good direction for me.
That's amazing.
Mhm.
Can you talk a little bit about that transition from like working under someone to you starting your own mobile practice?
Mhm. Yeah, it's very stressful for sure. A big part of the reason why I wanted to do it though is because for me it was really important that I had flexibility, especially dealing with what I deal with. I still have frequent doctor's appointments, frequent health visits. And I just knew working somewhere else, long term, I would lose that flexibility, which isn't good for my well being. So that was a huge reason why I decided to move and try to do something on my own, right? I didn't want that kind of pressure on me. Um, I always say this, the truth is employers, everybody, even friends and family, everyone always says they're okay, they're for accommodations, for accommodating people until a situation happens where they actually have to accommodate someone. And
Mm,
then a lot of it is just, you realize a lot of it is actually just, and I think pretty much migraine patients, a lot of our patients who are listening, they can probably resonate with this, that oftentimes these accommodations that people are supposedly offering a lot of times it's just lip service, right? So
mm,
we as a society have to do better.
yeah,
Mhm.
definitely. Do you have any words of advices for anybody dealing with chronic migraines or different type of headaches to cope with it, and maybe any advices to cope with like the mental side of dealing with a chronic illness?
Yeah, that's a great question. I think the main thing that people have to realize is there are actually a lot of options out there for treatment, right?
Hmm.
I think people think they have this migraine, they try a couple of maybe triptans, or they try some CGRP medications, um, and they think that's the extent to which they have control over their situation. Um, but let's just talk about the pharmaceutical side first. I do think pharmaceuticals are a big part of migraine management. If if I have a migraine patient who doesn't have a neurologist on board, I'm not very comfortable with that.
Hmm.
So, but in terms of the medications, there are tons, and there's a whole host of medications out there to try. So sometimes people try one or two and they feel really discouraged. And I think it took me like through 2 to 3 years before I really found some kind of preventatives that seemed to help. Going a little bit beyond that, um, and then we look into the more conservative care, like physical therapy, right? This is a really untapped tool that patients are not utilizing. And it's not always their fault because, truth be told, a lot of neurologists don't have it on their radar either, right? I met a neurologist and I told him, what I did, and he was actually quite dismissive of my work,
Hmm.
interestingly enough. So that was jarring, but but most most neurologists uh, are big advocates of PT, and they will recommend it frequently to their patients, especially if you have a large cervicogenic component. So I think it's definitely worth exploring that end. And then going beyond that, people sometimes they go to PT and one PT doesn't work for them and they kind of chalk up the whole thing. But you have to realize that migraine comes with so many presentations and different PTs have different strengths. So maybe someone who has a large cervicogenic component, they'll do really well with an ortho PT. But
Hmm.
then say somebody has vestibular migraine, maybe they'll do really well with a vestibular PT, and so on and so forth. Um, but what we're really lacking now is just like someone who can kind of blend it all together, which is what I'm really trying to do. And then in terms of mindset, you just can't give up on your health, right? That's just not something you should do, right? I'm very big on that. I know it's really hard to stay hopeful. Keep trying new things, and if you tried something and it didn't work, don't take it as a loss. Don't take it as a waste of time, because you need to be trying different things, and that means that you're likely going to have a lot of things that fail until you find the thing that succeeds. It took me 5 years. So before I found vision therapy, and then in 12 weeks, I had a huge difference. So just keep going, keep your head up, take it one day at a time, and just keep trying different things. And if something doesn't work out, just keep moving forward.
That's awesome. Don't give up
Mhm.
on your health. I'm really glad you're in that space.
Yeah.
Jimmy, is there anything that I haven't asked you about that you want to mention as any like parting words or any shout outs you want to give to anybody you're very thankful for?
Shout outs. I'm kind of blanking. I think we covered. I think we
That's
covered.
okay.
I think we covered pretty much everything. I guess, if you don't mind me doing a plug, you guys can just check out my Instagram.
Yeah,
It's just at Pang Physical Therapy, PANG Physical Therapy. Check out my website, pangphysicaltherapy.com. I think it'll give people a good idea what I do. And then if this migraine space, if you're a PT and this migraine space is interesting to you, feel free to go on my website, shoot me an email. Happy to chat a little bit. I would love to see more PTs get into this world.
that's amazing. Jimmy, thank you so much for your time.
Thank you. Thank you for having me.
Bye.